Hi, and welcome. Today we're going to talk about sickle cell disease, a hereditary hematologic disorder that is characterized by abnormal hemoglobin formation leading to the distortion of red blood cells into sickle shapes, that is, a half moon or a crescent shape. Now, this presentation aims to deepen our understanding of the pathophysiology, genetic factors, clinical manifestations, diagnosis, and management of this condition. So, not wasting much time, let's get started. All right, so here let's try to explore the simple structure of hemoglobin, which consists of heme and the globin components. We do have the beta globin chain and we have the alpha globin subunits as well. But in this video, we will focus specifically on the beta subunits. In context of sickle cell disease, our attention is going to be mostly here. Typically, hemoglobin is composed of two alpha globin chains and two beta globin subunits. And this is what makes up the normal hemoglobin of an adult. Okay, there are also different types, and we're going to look at, for example, HbF, which is found in fetal blood, and it comprises of two alpha chains and two gamma chains. Finally, we're also looking at the uncommon one, or the less common, which is known as HbA2 right there. And this is made up of two alpha subunits and two delta subunits. So understanding these variations will deepen our insight into the molecular structure of hemoglobin functionally, as well as the implications of mutations in the beta globin chains, which is linked to sickle cell disease, in this context. In sickle cell disease, the primary focus is on the abnormal beta globin chain, which is known as beta S, simply because the sickle mutation is found in the beta subunits. So the beta subunits plays a critical role in the pathophysiology of sickle cell disease. When both the beta globin chains, that is the subunit right here, or this one is affected, this leads to the presence of beta, that is both beta subunits are affected with the sickle mutation. And this results in the formation of a hemoglobin, which is represented as HbS or HbSS. So let me try to represent this another way. In patients with this condition, the typical arrangement of hemoglobin consists of two, that is, normal alpha globin chains. Okay, and this is paired with either two abnormal beta globin chains, which forms the HbS, which is of interest to us today. There is the other one that is two normal alpha, and then one normal beta, and another beta that is affected by the mutation. So this, or the latter one, is indicative of a sickle cell trait, okay, the one here. So we are yet to see how this configuration of HbS can cause red blood cells to attain the sickle shape. By that I mean the half moon shape, sickle shape, like that, okay, under the low oxygen conditions, leading to a variety of complications. Okay, here I have a slide I'm going to use to compare normal red blood cells to the sickled red blood cell and what the mutation does to the beta globin chain. So we have a normal adult hemoglobin, HbA, and this comprises of two alpha and two beta subunits. So in normal red blood cells, there is no sickling. And so I want you to take a look at the amino acids you find here. And specifically, I want you to note number 6. Number 6 should actually have glutamic acid, which is hydrophilic. And so when you have glutamic acid at number 6, then the red blood cells would have that normal shape. Okay, now let us take a look at HbS. And here we have two alpha and we have the beta globin chains mutation. So the reason is that there is a genetic mutation that actually substitutes the hydrophilic glutamic acid you recall here, okay, at number 6 with a hydrophobic valine right here. So this happens at the 6th position of the beta globin chain. Now this seemingly simple alteration leads to the irreversible aggregation of these HBS, okay, within the red blood cells. So there is an irreversible lineup of abnormal HB polymer. Okay, HBS retains some ability to transport oxygen, though, but it undergoes such a dramatic conformational change upon deoxygenation and then transforming into the crescent or the sickle shape as a result of that. Okay, and the polymerization also results in very fragile sickle cells, meaning that those sickle cells can easily hemolyze and they do have a poor holding oxygen capacity, which leads to the vaso-occlusive crisis, leading to painful crisis as well. So I guess you're thinking this is a lot of clinical manifestations, right? But to aid in memorizing the clinical manifestations of sickle cell disease, I have created a helpful medical mnemonic using the word apricot, with each letter standing for a significant aspect of the disease. Sickle cell disease is an autosomal recessive genetic disorder, and sickling of the red blood cells may cause acute painful crisis, okay, which is due to vascular occlusion, resulting in sudden episodes of severe pain, often affecting the chest, abdomen, and the joints. For example, dactylitis may occur. Now, the chronic hemolysis associated with the disease leads to anemia as well, with clinical signs of jaundice and pallor observed due to increased breakdown of the red blood cells. Complications can also include aplastic crisis, okay, which may occur when the bone marrow's ability to produce red blood cell is temporarily impaired, often triggered by the virus parvovirus B19. Additionally, individuals with sickle cell disease may experience aseptic necrosis of the femoral head, and this is a condition that is caused by reduced blood flow to the bone, leading to pain and the potential disability. As you can see P right here, this represents parvovirus B19 infections, papillary necrosis of the kidneys, as well as priapism, which I didn't put here, but you may do so. R, on the other side, represents or serves as a vital reminder of the multifaceted challenges faced by patients encompassing retinopathy, okay, which can lead to vision impairments due to retinal damage. There is also retardation of growth seen in children and renal complications such as isostenuria, where the kidneys, that is, struggles often to concentrate the urine, and chronic kidney disease may also occur. Now, in patients with sickle cell disease, the risk of infections right here is also notably heightened, often acting as a catalyst for the exacerbations of hemolysis, right? Furthermore, there is a potential for organ infarctions, which represents another critical aspect of the condition, as the sickling of red blood cells can obstruct blood flow, leading to tissue damage. So that is regarding infections, and there can also be jaundice, as already mentioned. Chest syndromes, that is in sickle cell disease, may present similarly to pneumonia, often due to lung infections or pulmonary vaso-occlusions, leading to symptoms such as cough, chest pain, and difficulty breathing. Additionally, patients may also develop cardiomyopathy, okay, and this occurs as a formidable complication from chronic anemia and hypoxia. The chronic hemolysis can also lead to cholelithiasis, formation of gallbladder stones from the excessive bilirubin pigments. Okay, now sickle cell disease is also characterized by painful occlusive crisis that results in ischemia and the potential tissue infarction. Now, osteomyelitis, I want to mention, may also occur in patients, particularly from pathogens like Staphylococcus aureus. And not only that, and your licensing exams may also ask you for salmonella, which may also be seen. And this is actually due to their compromised response and the propensity for bone ischemia. Transient ischemic attacks may also occur or may be seen due to temporal disruptions in blood flow to the brain. And splenic sequestrations crisis is a serious complication where sickle cells accumulate in the spleen, causing pain and potentially severe anemia from rapid loss. Other complications of sickle cell disease include spontaneous abortions and skin dystrophic changes such as ulcers. In the investigation of sickle cell disease, one often encounters several indicative signs and symptoms of hemolysis, including an elevated indirect bilirubin, as well as reticulocytes, with a decreased haptoglobin levels, which signify an increased destruction of the red blood cells. A complete blood count may also reveal a decline in hemoglobin as well as the hematocrit. There may also be leukocytosis because the infections can often predispose the sickle cell patient to hemolysis. HB electrophoresis is used for confirmation. Furthermore, examination of peripheral blood often reveals characteristic that is the crescent or the sickle-shaped red blood cells, which looks somehow like this. Okay, there may also be additional findings such as Howell-Jolly bodies. These are just DNA inclusions that you find in the red blood cells, and nucleated red blood cells as well as target cells may also be seen, which may all contribute to the diagnostic picture of the disorder. Note that infections frequently also trigger exacerbations, as I already mentioned, that is hemolysis and vaso-occlusive manifestations. Hence, chest x-rays may help identify conditions like acute chest syndromes, which often mimic pneumonia. Urinalysis plus culture may also be useful for assessing urinary tract infections. For the same reason, inflammatory markers like C-reactive proteins, ESR, may also be useful for the investigations. Now, regarding screening, okay, this is very important. Regarding screening, sickle solubility test is a straightforward method, and in regions where sickle cell disease is quite prevalent, utilizing cord blood at birth can facilitate early detection of sickle cell disease. All right, so here we have a medical mnemonic, hot ABCDs, that is going to be used to memorize the management of sickle cell disease. The effective management of the disorder involves several critical interventions, with hydration being one of the paramount interventions to prevent vaso-occlusive crises as well as renal impairments. Oxygen therapy may also be employed based on oxygen saturation levels, while transfusions, this include blood and exchange transfusions, this may also be essential for managing hemoglobin levels as well as disease severity. Now, in cases of acute painful crisis, potent analgesics like morphine may be used at the hospital setting, and non-steroidal anti-inflammatory drugs should be used cautiously, especially in patients with renal concerns. Identifying and treating infections with antibiotics here is also crucial alongside supportive therapies like folic acid supplementation. Bone marrow transplant is curative. Now, in order to reduce the episodes of crisis, hydroxyurea, crizanlizumab, TMCA, and L-glutamine may also be used. Keeping immunizations current is vital for infection prevention, and techniques like incentive spirometry can further help in averting pulmonary infections. So here I want to mention DNA or the gene therapy, which is a fantastic innovation. This has been approved to be used for the treatment of sickle cell disease in some developed countries. So gene therapy is a fantastic treatment modality. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.